Welcome to the Catch Up with Claire. I'm your host, Claire Hoon, and every week we hand the mic to women who are showing up, speaking out, and figuring it out in real time. Because when women start talking, no topic is off limits. Careers, identity shifts, friendships, family dynamics, breakups, big dreams, bigger feelings, and yes, motherhood too. Think of it like calling your best friend on the landline in 1999. Lighthearted, unfiltered, and somehow deeper than you expected. Whether you're raising your kids, raising standards, or raising hell, this space is for you. So settle in. It's time to catch up. Welcome to the Catch Up with Claire. I'm your host, Claire Hoon, and today we are catching up with Jamie. Jamie and I met when we were both at the Motherhood Center in their partial hospitalization program. We were receiving life-saving care and treatment for postpartum depression and anxiety and have been friends ever since. When you go through something, such an intense, traumatic experience together, you kind of have a way of being bonded for life, and that's what happened for Jamie and I. In this episode, we talk about our experiences with postpartum depression. We talk about how we overlapped at the Motherhood Center, how we decided to stay in touch after, and how she's been one of my closest motherhood friends ever since. Is another episode as part of my maternal mental health awareness series. If you are in a place struggling with your mental health, needing of support, please, I invite you to pause before listening to this, pass, come back to it, or not when you're ready. If you are needing of support, please reference the show notes and get help. We want you to know that treatment exists, treatment is effective, and you do not have to continue to suffer. With that, please enjoy this episode with Jamie. Jamie, welcome to the Catch Up with Claire.
Thank you. Very excited to be doing it.
It is the month of May, Maternal Mental Health Awareness Month. Jamie and I, such a close, good friend, and so grateful for you in my life, but also the way in which we met, I wouldn't wish upon anyone. But when you talk about glimmers and little, I don't know, notes of positivity that come from really terrible things, your friendship is without a doubt one of those things. Jamie and I met in a partial hospitalization program, PHB program here in New York City, the Motherhood Center. We both have similar severe stories with postpartum depression, and we ended up being in a similar cohort at the Motherhood Center. So we're going to dive into that. Jamie's going to talk us through her story with PPD. But before we do, I feel like we need to just warm us up a little bit. I could introduce you, but introduce yourself in your own words for us.
Let's see. Well, after I graduated college, I was living in New York City for about 13 years, which is where I had my first son and the experience that Claire referenced. I work in the advertising industry, which crosses over a lot with tech and PR, event planning. I met my husband in the city online, which is how I knew I was going to meet my husband. So luckily that all worked out and we did the cheap one. We did OkCupid, but still a prosperous marriage. That's okay. And I had my daughter, who is now 4.5. And then that was during the pandemic, which is when we moved back to South Jersey. So now we're living outside of Philadelphia and I just have to lust after my old life in New York.
Wait, I have to go back to how did you know you were going to meet Dave on an app?
You know, when I graduated college and moved to the city, I was the first one of my friends to move. So there wasn't I'll meet someone through a friend. It was more work happy hours and then continuing on the night and trying to meet men. And that just wasn't happening. And then the online dating thing came out. I was like, oh yeah, this is how it's going to happen. So I serially dated monogamously, 2 or 3 other specimens before finding my sweet Dave. So we had some tryouts and then, he made it to the big leagues. And here we are.
This is why I love you. We tried out some other specimens.
We did. You got to try out. I mean, you're in it for the long haul, hopefully, not for everyone, but sometimes you got to do tryouts. You got to see what happens.
And look at what you landed. Beautiful family. And how many years later? 10, right?
He's the one that keeps track, but I believe that we're coming up on 10 years, which is going to be a good gift. Yeah.
Okay. So knew you were going to meet your husband online. Did you know you guys wanted a family? Did you know was mom a title and identity you always saw for yourself? Talk to me about because we didn't know each other before pregnancy or before having babies. What was that like for you? Were you like jumping in, eager, ready to go? Were you newlyweds for a little bit?
Such a good question because I feel like that is really where everything starts. To me, motherhood, the title, the experience was like a final thing on my to-do list. As a
Mm.
type A Jewish woman, it's just like, all right, what we got to do? Like what's the next thing that we have to get done? And growing up, it was, make the team, get elected in for this, pass these tests, hit AP, get into the good college, get the intern. Like it's just like the next and the next and the next. So after Dave and I got married, um we were only married, I think, for about a year. And then it was just like, all right, this is the next thing that we have to do. Um, and we were, not rushing into having a family. We were just like, whatever happens, happens. And when you have that kind of attitude, you get a baby right away. The two things almost go together. So we got pregnant immediately. And it was kind of like, that excitement that I had achieved something. It was like, this is like something to
A
check off
win.
the list and like, yeah, it's like you get it done and you're like proud of yourself that you were able to achieve it. And that achiever mindset was something that has always served me, the rest of my life. But I don't know if you agree. I don't know that it's necessarily serves you in terms of motherhood. Motherhood is not something you necessarily can achieve at.
It's totally mind warping. Like, I think it's like, especially you said, like the type A person, like we've always had a criteria or a rubric. Like in school, you get your syllabus at the beginning of the semester, you know the assignments, you know what you have to do.
Yeah.
There's a grading criteria of if you meet these points, you will achieve this amount. Same, like we've just always been in an environment or in situations conducive to being able to like you know what to do. You know how to perform and you know how to meet where you want to be at the top. It doesn't exist in motherhood. And that was like shocking.
Yeah.
I don't for me, at least, like, I didn't like, there's this I think it's, like, this societal pressure to be a quote, unquote, "good mom" or perfect mom,
Hmm.
but there's no rubric, there's no syllabus, there's no definition of what
Right.
that means. Although everyone is held to this standard, there's no, like, what does that mean? It looks
Right.
different for every single woman and family.
And not only that, but there's no grades, right?
Yeah.
Like even if you
What do
try
you
without,
mean?
where's the
I'm
prize?
acing it.
It's like even if you, think that you don't have the rubric, but you try to do it, no one is going to tell you, well, people might give you their opinion, but no one has an answer on like what's necessarily right or wrong, or if you got 100% or not. Um, and I remember there's a couple things I remember before having my son. One was actually a father who said to me, I know a lot of people are probably giving you like a ton of advice and you're like reading all these books and you're trying to prep for this. But let me tell you, like, as soon as that baby is here, you will forget everything that you took in. So, like, enjoy the time now that you can and, like, just recognize that everything, that you're trying to learn will go out the window. So that kind of had a big impact on me. And the other thing that I heard after having babies, after you and I had been through this horrific experience, I think it was on a TV show, but someone said, "You don't learn to be a mom, you live it." And I
Mm.
think that has always really resonated me, and when other moms to be ask me for advice, because I never give it out unless you're gonna ask, because I don't wanna put my opinion on anyone, that's kind of what I say. Like, y you live it.
That's a good one. That's a good one. Okay, so excitement. You felt like you got that positive pregnancy test and you were excited. Did that last through pregnancy for you?
No, it didn't. I really didn't like the experience of being pregnant, as a woman like many others that has strong opinions about my body and the way that it looks and how I, keep in shape. To me, the pregnant body was not beautiful. I respect if other people feel that way, but to me it wasn't, and on myself it wasn't. And I was still trying to achieve something. And, I just remember my therapist saying to me, like, you are telling yourself what you're allowed to look like and not allowed to look like during pregnancy. You have no control over that. Like your body will change and you're trying to set like these parameters for it that are not realistic, and it's gonna, lead to a problem. So I think, there were warning signs along the way. But yeah, so I struggled with that. I struggled with the comments that people would make to me. And I'd actually love to hear your story. Like, one of the weirdest things someone said to me once, I was on a business call and they couldn't see me. I didn't know them. It was my first time. I make tons of calls every single day with different vendors. And I had mentioned that I was pregnant. And when we got off the phone, this guy said to me, "Congratulations, I'm proud of you. Like, I'm proud of you for being pregnant." And I was like, that's like a bizarre thing to say. Like, why are you proud of me?
Mhm. Like, what?
Yeah, and I had another guy in the elevator at work be like, "You're a sexy pregnant lady." What do you think? Why do you think you can just say that to me? Like, how strange. Do people make comments
I
like
had
that?
2, one during pregnancy and then one right after I got back from maternity leave when I was an entirely different person and, like,
Yeah.
was still in the very much in the thick of it, like, couldn't handle. The one
Yeah.
while I was pregnant was, I'm not into, I mean, I am now. I wasn't super into, like, astrology and signs, and our babies were born in July, and so someone said, "Ooh, you're having a Cancer baby." And my brain, also, like, being highly
Mm.
anxious, went immediately to, like, they were telling me my baby was going to have cancer, and I looked at her and I was like, "What did you just say to me?" And she was like, "Yeah, like, July is the cancer month." And I was like, "Holy guacamole." It took me a minute to come to and be like, "Oh, you're, like, telling me the astrology sign based on my due date." And she was also had that same sign of Cancer and was like, "Good luck," which has gotten me into it. Like, I'm in an Aries, and so I've always been very into my own sign, but when I understood what Cancer babies and not Cancer babies, people who have the astrological, I don't know the right word, sign of Cancer, my 2 Cancer signs are it to a T,
Mm.
which is challenging. So that was a weird one because I was also like, What?" Um when I got back, there was a man, who started on my team when I was, like, 8 months pregnant, and this was pre-pandemic, so I was going to the office 5 days a week, and I went up until my due date was on a Sunday. No, it was on a Thursday, and I was going up until, like, that Monday into the office, and I was not cute. Like, I was not a cute pregnant person. I am short, and I was large. Um, my baby
Same.
was almost 9 pounds. And so when I got back from leave, though, um, the first thing he said to me was, "Claire, now that you're not pregnant, I can see how beautiful you are." And I was like,
Mm.
"What?" Like, "Sir, first of all, you have no idea what I have just been through the
Right.
last 12 weeks of my life, 16 weeks, really. And, like, what are you saying to me?" Like, it was just one of those moments where I was ready to fight, like, I was like, "Hold my
Yeah.
earrings," but, like, he truly meant it as a compliment, which, like, in retrospect, like, I get, and I, like, know, like, you don't really know what to say, but, like, don't say that.
But don't say that.
Don't say that, and, like, just don't say anything. I'm, like, very probably, like, similar to you, uncomfortable with people commenting on my body and how I look anyway,
Right.
especially at work, so I'd
Right.
rather just move on. Like, if you don't wanna ask about the baby because you don't have children, just, like, welcome
Yeah.
back. Welcome back.
That's enough.
Good to see you. I don't know.
And it's odd that, like, both of our stories were at work too, right? Like, where we
Mhm.
have maybe another part of our identity that we care about, that we've worked hard for, that gets sort of packaged into, like, a pregnancy baby box that doesn't even need to come to work necessarily if you don't want it to, that other
Well,
people.
also interesting that you pointed that out because both of us being, like, very high achieving, ambitious, and, like, particularly career focused, especially before motherhood, and I don't know, maybe not, similar to you, you'll tell us, like, I was like, "Motherhood is not going to derail my career goals. I am not gonna become someone who suddenly can't perform, can't meet numbers, can't do these things that I've done because I now have a baby." Like, I still have to perform, like, performing well at work still has to be the top priority,
Mhm.
not being a mom, which in 8 years of motherhood now, I have a much healthier mindset around that, but it took a really long time. I also was in a much different place in my career when I got pregnant than I am now.
Yeah, no, I totally agree with that. I just like with my body, I was presetting what the parameters were going to be, how I was going to act, and how I was going to balance everything. And again, I go back to you're just going to live through it because you could try to plan that, but you don't know what your job is going to demand at that time. You also don't know what your kids are going to demand at that time or the rest of your family, your partner, your own parents. I mean, there's so many variables that it's not possible with our best intentions. It's still not possible. I don't
I
think
heard
so.
you No, I agree. I heard you say so you were in therapy while you were pregnant. Did how and you also said, like, there were warning signs. So talk to me a little bit, like, what was that like being, like, as a first-time mom, already in therapy and pregnancy? Like, where did it come sort of into your level of awareness of, like, maybe I'm suffering because of the pregnancy or maybe I'm feeling this way because of the hormones? Or did it all accumulate postpartum and I don't know
Yeah.
what I'm trying to ask.
No, I totally understand what you're trying to ask, and I remember it really clearly. I felt fortunate that I was already, in a good relationship with my therapist who I've told her will never leave me. We're gonna die together. It's gonna be sweet. But anyway, so, we had been preparing for this for a while. Once I got pregnant, which as an aside, I'll never forget this. The day that I told her that I was pregnant, she did not say congratulations. Speaking of comments.
Mm. Mhm.
And it haunted me for a long time. I finally, like, got up the nerve to, like, ask her why, and she was like, "Because I don't know if you were happy about it or not." And I was
I
like,
do love
"Wow."
that.
Yeah. Yeah, she's a good one.
Mhm.
So we'll be together forever. But anyway, so we were prepping, for the possibility, of having anxiety and depression going through this, but I have to say, even talking about it with her, it still didn't manifest until I went through it, the level
Mhm.
of pain you could be in. Because I have suffered from mostly anxiety, not as much depression at the time. So to me, it was like, yeah, I know what that's like. I'm fine. Like, I have a therapist, I take medication, I know how to handle this. And by the way, we're also prepping for it. So I felt like my bases were sort of covered. That said, to answer the second half of your question, as we got closer to my due date, there were some OCD-like tendencies that I was leaning into, and OCD was never one of my diagnoses of all of them. That wasn't one. Just in our tiny ass New York City apartment, we had a fake room for my son that we were putting together, and like there was this thing with the carpet, like I wouldn't let anyone in there to touch anything here yet. There was nothing really in there. The crib hadn't even been put up. It was just like bags of stuff. And I was really sensitive about that space. So I started noticing that and just some feelings of like more aggressive feelings and like a darkness that was starting to come through. But I blame that on just physically how I was feeling, getting to that point and how, you lose kind of control of your body. You're giving it up to something else. So we were prepping, and it still couldn't have prepared me for what we ended up going through.
Did you know? Because you used the words you said OCD-like thoughts and feelings and behaviors. Are you able to label that in retrospect, or did you recognize that as you were going through it of, like, "I'm really protective about this baby's space. I don't want people in here on the carpet. I don't want them touching his clothes because, you'll tell me," like, was it a fear of germs or contamination, or was it just what did it feel like? And was it intense enough that you flagged your therapist at the time, or were these all sort of in retrospect, you can see sort of the dominoes slowly falling and we're able to put it all together after after the
That's
yeah,
such a good question. It was all after.
yeah.
So while it was happening, it was just what it is. I just felt protective, base of the baby. It was still something like on my to-do list that I had to protect and be ready and get all my stuff as clean and orderly as possible. So I think I would not have labeled it that until after we went through everything and looking back. That's just a memory I have of getting really upset when there were people like coming in and out of that room.
And I asked it purposefully. I presume that was because, like, in my own story, similar things. I had this obsessive thought. I had a couple of obsessive thoughts, but
Mm.
one was also living in a tiny New York City apartment, 1 bedroom, 600 square feet. I was committed to making that 1 bedroom work, and everyone was like, "You guys have to move. Like, you have to get at least a bigger 1 bedroom or a 2 bedroom."
Yeah.
And we were looking at these apartments and, like, balconies here. I grew up I've never had a balcony, like, I lived in a house my whole life, and I had this thought of, if I have a balcony, like, there's gonna be one day where Zach's gonna be at work, and I'm just gonna lose it, and I'm gonna throw the baby off the balcony. Like, I was, like, so obsessed with this thought, and it freaked me out, but I didn't 1, I never told anyone that 'cause I was gonna, like, they're gonna think I'm a terrible person for even thinking that. They're gonna think I'm a terrible mom, and so I kept it to myself. I never even told Zach until afterwards, and it, like, culminated into, if I had been talking about this all along, that I was having these thoughts, I just thought it was
Mm.
normal. I just thought this was, like, being protective of my baby. I just thought this was, like, a normal thing to think, or, like, that it wasn't a symptom, basically. But I think that's, like, we aren't given the tools or the warning signs when we're pregnant to flag these things that we're thinking or feeling.
I agree with you, and not everyone talks about it. But
Right.
I will say this, kind of another memory. There are women that do talk about it, and I just remember, and my heart, like, aches whenever I think about this. There was a woman in my office at the time who had just come back from having a child, and I don't even know if it was her first or her second, and she, like, caught up with me in the kitchen, and we weren't super close, but, I see her around, and she knew I was pregnant, we were talking, and she was going through this story about postpartum psychosis and anxiety and, like, agoraphobia, fear of, the wide open spaces, and she was just, like, tethered to her house, and I just remember being in the kitchen and, like, listening to the story and thinking, "She's crazy." Like, this is a crazy person, and, like, that's not something that's gonna happen, and, I never repeated her personal business to anyone, but I judged her, and I'm sorry to you, if you're watching, because it's, until you go through it yourself, and people don't talk about it a lot, so, like, I think it's amazing when people can tell their stories because it takes more of that, because to your point, you don't know what you're supposed to be thinking or what's normal or abnormal, but if other women were speaking about it more, it could help normalize it.
I don't think that there, and I don't know, unless you're, like, a very, very special human, that there is no way to truly understand what you go through postpartum until you experience it. But to your point, I think that's why it's important to talk about and to show the full spectrum of experiences, from,
Yeah.
even if you're having a good time and not having any type of mood or anxiety disorder, it's still really hard.
Yeah.
And then on top of it being really hard because you're caring for a human for the first time, layer in all of these emotions and hormonal changes and all things. It's just like a recipe for disaster.
It is. But
You
I
have
like what you said about spectrum, 'cause it really is a spectrum from the beginning to when you're going through it, it's just there's so many varieties. It is not one thing. It is not black or white, and that's something I'm super guilty of, leading up to this, going through it, and even today, I just put things here or there, and I don't think about, like, what's in the middle all the time, so I think it's important to remember that, and I think it's a good point.
When and what changed for you postpartum? Because if I recall, you had a difficult birth. Was it immediate? Was it in the hospital? Did it take a couple weeks of, like, maybe this is just baby blues? Talk us through sort of what birth was like for you, and then also, like, when did things start feeling like they were taking a turn that needed more attention?
Yeah, sure. So I delivered at Mount Sinai, Upper East Side. I had started having contractions. We went to the hospital, and then the process is, at least there, they put you in triage. They check if you're dilated. I was not dilated enough to be admitted. And then, like, apparently the secret is to say that you want the epidural, and then they admit you right away. That was something at one of the birthing classes they had told me. But again, like, going back to this achiever status, I really believed I had to get dilated, and that was something I had to do. That's not something I could get help with. So my freak ass walked around with the contractions for 3 hours. trying to dilate by walking in severe, severe pain. And of course, like it's not, you don't know what's going to happen, right? So, like,
Mhm,
that didn't
mhm.
work for me. So finally, I asked for the epidural, they admitted me. And then that's really an interesting moment because here we are, both you and I, strong, independent, career driven women. And I feel like the hospital is a whole other planet. And there's different rules, there's different people in charge. And, if you are fortunate enough to have not spent a lot of time there, you just kind of give up your humanity to the system because how else would you know what to do, right? So, like, once I was checked in and admitted in my room, they wanted to start pitocin, so they started pitocin. And it's like, looking back, it was like, oh, what should I do? And it wasn't a moment, even if I had done the research, to think about it, because you just think you have to do what they're telling you to do. So we started the epidural. My blood pressure dropped a couple of times. I blacked out. I got very sick. They started the Pitocin. And so, like, that beginning part was kind of messy and scary. Once I ended up, going into labor and actually starting the push process, that was amazing. And I'll say, like, that's my favorite memory of the whole thing. It felt exciting. It was just the coolest, most unique experience. I was numb, so I couldn't feel the tremendous amount of pain that I'm sure was going on. And, like, pushing him out was beautiful. And then the way I've described it and, some pieces that I've written is it was like, that's when the Grey's Anatomy staff is there and, like, the beautiful people and the cinematic lighting. And, like, once that baby comes out, those people go away. And there's a lot of blood and there's a lot of mess and there's not a lot of instruction or talking. And it was like I had one sweet moment with my son and they put him on my chest and he like went for my nipple. He like bit me. I don't know, no teeth, but like clenched pretty hard around my
Mhm.
nipple. And I
Oh,
was trying
yeah.
to, am I supposed to be feeding him? I don't even know. I don't know what to do. But I couldn't even think about that because the nurses grabbed him off my chest and they were screaming, he's tacky, which I didn't know what that meant. It means tachycardic. And then with that, he was out of the room. They took him away. I still don't know where. I'm sure I could find out, but I don't know where he went or what they were doing for him when he was away. And I also don't know how they fed him because no one asked me if I wanted to breastfeed or formula feed. I know those are questions that, unless I went back through the system, I'll never know. And so I think that's the moment that things were going to start to go really downhill because now I've had this baby, but he's not here. It was 3 o'clock in the morning. We were not able to get a private room because in New York City, you need to book those and pay a tremendous amount of money. Well, they were sold out by the time my husband needed to leave because visiting hours were over. And if you share a room with another woman on that postpartum ward, you can't have anyone else in the room. So he left. I hadn't eaten in close to 24 hours. They put me in the bed. They said that my husband would be back, in like 4 hours, 7 a.m. I went to sleep. And then when I woke up, that's a crazy thing when no one is there with you after going through that experience. So my son Dayton wasn't there. My husband wasn't there. I had to use the phone to ask where he was. And, like, one thing I just want to say, and maybe we'll talk about it later, but like, this is a new person in your life, this baby. You don't have a relationship with them yet. Whether you are excited, not excited, you have postpartum depression or you don't, this is a new person. And that relationship has not formed. So it's a strange thing to be like, where is this new being that's going to be in my life forever, hopefully? Like, I don't know where they are, how I'm supposed to be taking care of them. So they wheeled him into the room. At the same time, I was finding out that I wasn't able to urinate after having him. And I was trying to tell a nurse that, but was being yelled at to breastfeed
Mhm.
at that point. Just feed the baby. Don't worry about yourself. Feed the baby. He's starving. He's starving. Upon asking, okay, well, how do I breastfeed? Because I didn't know, and it's okay not to know or for it to not come naturally. That nurse told me, I can't tell you because if I tell you, you'll never know how to do it yourself. Yeah. So that was the first part of the experience. Then it,
Yeah.
kind of turned into a whirlwind. I ended up with like a massive bladder infection because they did need to put the Foley in me to release the urine, and they ended up doing that over and over again to a point of infection because I just, my body just wasn't snapping back. And for the rest of the time I was in the hospital, I was mostly naked. I never showered. I never changed out of the gown, and no one said anything. And I understand that a lot of people are coming in and out. I have a tremendous amount of respect for the medical staff, but they need training too, I guess, because I was really losing my mind. I mean, I was walking around naked and no one said anything about that. And then, eventually we left the hospital, and I do remember after leaving with my son, I heard like a siren. And I knew it wasn't real, but I just heard when we left, and it like wouldn't stop. And like that was maybe like my body saying like something is still wrong.
Mm. I knew you had a hard birth. I don't think I knew that full story. And like the way you tell it, oh my gosh, Jamie, I'm so sorry. But it's like not but because like full stop period. You shouldn't have never experienced that. No woman, birthing person should have to experience that. And like you said, it's immense respect for medical staff and like the people who are treating people in hospitals.
Yeah.
And it's a systemic failure that this is the way that so many women birth in New York City. I didn't even think to bring up because like you're just so used to it here. We don't have private postpartum rooms unless you pay an arm and a leg or go
1,000.
to a hospital. 1,000. I mean, we did the first time, so I feel but, like, you can't I don't know about we didn't go to Sinai East Side, we went to Roosevelt, and you couldn't sign up. You had to as soon as you were admitted, you sent your support person to, like, the desk, I don't like, whatever nurse station, give them your credit card, and your credit card goes in line. There's only 3 on the postpartum floor, and so it just is total luck of the draw, kind of. It's not luck of the draw because it's stupidly expensive. It was thousands of dollars, and I remember doing the rate. This is more we pay per night for than we would for a hotel in New York City for, like, 2 nights, but I was so anxious. I was like, "Spend the money." Like, I will not be okay. I knew that about myself. I was like, "I will not be okay alone." Like, I was so freaked out about having a
Yeah.
baby, and, like, I think we just got lucky because I ended up going into labor in the middle of the night Saturday, and it was a weekend, and there weren't any planned inductions, there weren't any planned C-sections, like, it was just that anyone who goes into labor spontaneously,
Yeah.
and it was also 4th of July weekend. And so it was like a holiday. It just was a quiet I think we just got lucky is all that
Yeah.
it came down to. But I mean, I think I would have like walked out of there naked if I had been alone. Like I am
Yeah.
so sorry that that was your experience, but I think it like starts in the hospital, which is also the frustrating part of it of like where are there more eyeballs on a birthing person than in the hospital? Why are we
Right.
not intervening early and not just with you because you just gave birth? But with the people who are coming in and out of our rooms to visit the baby, with our family, with our support person, with our partners. Like, I remember sitting on the bed at discharge day and I was holding the baby and they're like, okay, give the baby to dad. And so I did. And like, we're going to go through all this paperwork with you. In my mind, like retrospectively, I'm like, I was clinging to that baby as a lifeline. Like you said, it's a new person you've never met before who for me there is this dissociation at birth because it went from I could feel this baby moving around in me and like had been like seeing and experiencing my body change for 9 months to I I didn't dilate on my own at all. My water broke and I wasn't dilated. I wasn't having contractions, so they had to induce me. It was a completely mismanaged induction. I was given way too much Pitocin, way too much epidural, could not move a single thing about my body. So like the baby was moving around in me to suddenly I was numb, not
Yeah.
feeling anything. The doctor didn't come in for hours at a time, and she came in and she checked me and I was literally crowning, like, the baby's head was there. She's like, "Oh, your baby's head is here, time to push." Like, no wonder I had so many postpartum issues. Like, how long had that baby like, he
Yeah.
literally, like, birthed himself out. And so it was this just, like, complete and then so I didn't have any time to think about pushing or prepare. and it just felt like this, like, separation of, like,
Yes.
mind and body, and I remember they put him on top of me, and the first thing the nurse said was like, "That's a big baby." Like, I hadn't seen or held a baby since I was a child. Like, I was the first one to be around babies. Like, I had no idea what was big or not, but, like, to me, compared to a normal human that I'm used to seeing, it was a very tiny baby. And then I also remember my immediate thought was, he feels like a slippery, hard-boiled egg. I'm scared. I'm so high up, he's gonna fall off of me. I can't say any of these things out loud because they're gonna judge me for thinking that my newborn baby feels like a hard-boiled egg. And so what feels like a hard-boiled egg? A dolphin. It's acceptable to say he feels like a slippery dolphin, but, like, and this was, like, in the first 30 seconds of pushing this baby out of my body, like, this is where my brain was, like, chaotically feeling shame, feeling like I'm feeling the wrong things. I have to correct the narrative. This is socially acceptable to say. Like, they're telling me that this is a big baby. What does that mean? Like, you're just onslaught to then, like, 48 hours later at discharge, I, like, couldn't let go of him because I was just like, must protect. It was like, I must protect the baby. I must
Yep.
protect the baby. I must keep this thing alive. Hand him to Zach. And they're like going through this paperwork. I have no idea what they told me. They just kept saying like, sign here, sign here, sign here. Were they telling me about signs of PPD? Maybe. Were they telling me of things to look out for? Maybe. Like, again, have no idea, but we're putting these undue burdens and stressors on new moms and like birthing people who've just gone through such a transformative experience. Why are we not using the support around them and in that room? Like, why were they not going to Dave or to Zach to say, like, this is what you should be on the lookout for, and this is how to take care of this person and the baby? I feel like it starts in pregnancy, but like that's such a critical point of intervention, and it can be, I feel like, and it's just missed.
It's missed. I totally agree with you. And, part of it is underpayment, understaffing for the medical staff, just trying to keep up with what's going on. And I do want to give like a lot of respect because I think it's a tough position to be in. And I will say, after I went through everything, I did post about it just to get it out of my head. That was the only reason I posted anything on Facebook because I don't normally post. Someone did contact me from the hospital and they do have like an patient experience team. They apologized. They brought me in and they did give me a platform to speak to the medical staff, which I took advantage of. So I appreciated that. And it just, goes to show no one is trying to purposefully be harmful, but life is at stake
Mhm.
for women who have just gone through trauma. I mean, it's a traumatic experience, whether it's good or not. So, yeah, the conversation does need to change, and people do need appropriate training. And the second time that I went through this, I did have a doula, which I think should be required and provided for every birth because it is someone who can be in the middle of you and this traumatic experience for better or worse. That can help give you back your voice when you're not sure how to use it.
I feel like it totally humanizes it, and, like, it's that you talked about a few minutes ago, the Grey's Anatomy moment.
Yeah.
Like, it's that person and that beacon of, you don't need to worry about translating all of the hospital jargon and Pitocin and epidural and dilation and all of these cascades of intervention because you have a person dedicated to just you, the mom or birthing person, to say, this is what's happening. These are the decisions to make. This is what's being recommended. This is why it's being recommended. And just be there for you so that you don't have to try and do all of this while also bringing a new human into the world.
It's too much. It's too much. And that paperwork, I think I threw out some of it. And then I was panicked about that because they said it was an official form. It was probably for the fucking birth certificate. But I just remember being like going crazy because of, the paperwork. Like that should be the last thing that like
Mhm.
we're going. I understand it's important, but that we're looking at and going through because we need to know what we're looking at and take it in. It's not going to be that moment.
Certainly not.
No.
Okay. So you get home, you have a little itty bitty perfect newborn. Talk to me about what happens next. How are the first couple weeks? How did things cascade from you there?
Yeah. So we got home and my memory of like the first week being home, it was the summer. He's also a cancer baby. We came home and I just remember it being dark, like all the time. I don't know if it was that the blinds weren't up or I was keeping the lights out, but I had an obsession with that. And then also it was very hot, but I wouldn't turn the air conditioner on. And I just remember being like just sweaty. And from the time we got home, I did not sleep through the night at all, period, full stop. I was just up trying to be on that cycle of feeding. And again, because I need the rules. I like what you said, the syllabus of how this was all going to work. I was told, this hour increments, whatever the process was for the breastfeeding. And I just couldn't get it down. He wouldn't latch. I fucking hate that word now. They gave me those nipple cover
Mhm.
things because of the damage that was being done, and then with that, the idea of having to wash them and sanitize them, it was just like there was always something that I needed to be doing, so sleep was off the table. So I wasn't sleeping, he wasn't eating, and then I think like 48 hours home, I called one of the lactation consultants. That was like one of the cards that was handed to me, upon discharge. She came to the apartment, quite early. She brought one of those scales, put the baby on the scale. And again, that message was very clear. He's starving.
Mhm.
Yes, he's underweight. So good. My maternal instinct kicked in that something was off. And then there was just like, I feel like this rush of like, here's a heat pack for your breasts. And like, you need the moisture and the warmth. And you got to put a little bit, it was just so much stuff. And also that siren was already going off in my head. So now you've added this on that I'm failing because he's underfed. At the same time that that appointment was happening, and this is wild, my doctor's office, the hospital was calling to say that the urine test I had done came back positive for that bladder infection, which, by the way, I had to beg them to give me the urine test because I knew something wasn't right. The pain that I was in, I just knew it was something different than just having the baby. So that test came back positive. And then right there on the phone with the lactation consultant there, they're saying to me, the way with this medication, you can't breastfeed on it. So you have a choice. You can either take this medication, which will help you with your bladder infection, or you keep breastfeeding. You'll suffer through this pain. It's going to take longer for the infection to go away. And that was, the choice that was presented to me. I did take the medication. We did start formula feeding. I mean, that could be a whole other talk on the formula versus the breast milk and just some of the stigmas and, the pressure around which choice to make, but that choice was kind of made for me because I was in a tremendous amount of pain. I had been talking to my therapist, my psychiatrist during that time, letting them know what was going on, the medicines, the lack of sleep. So people were looped in, but, you know, there still wasn't anyone clearly saying something is more wrong than normal. And it's hard to identify that. And the
Mhm.
message I got from my family was you need a beat, like you just had a baby. And I mean that is true. You do need to give yourself grace. But by the time like the full, I don't know, like 5 to 7 days had gone by, I was crying all the time. I was really sad. I did not feel a connection with my son, but like you said, I had a gut instinct that he had to be kept alive. But that was like my to-do list. Like he needed
Yes.
to be kept alive. I had to do that. And then I just remember in the dark room, super hot, no AC on. I remember like leaning over my bed and Dave was in the room with me and I was on the phone with my therapist on speakerphone and she said, "You will call the Motherhood Center tomorrow because you might not make it through the night." Now, this is clear, like there is something wrong and you need help. And like there's a lot of different types of therapists, but she's the type that does not ever tell me to do anything. We discuss things, we reflect, but like she never says you will do this. And it was like, you will not make it through the night, which was scary. And we hung up and like the next morning I would go to the Motherhood Center, but I think you might have been the same way. I fought that really hard because I had to achieve at this as I have with everything else in life. And I would do it because I needed to be strong enough. And so through the whole intake process, it was like I was kicking and screaming and arguing that, nothing was wrong with me, that I could do this myself.
Mhm. 100%. And I also I didn't have the same I had support around me, but none of us knew I wasn't in therapy. I didn't
Mhm.
have anyone around me flagging it as, there's something more going on here, and I think because I was the first person in my group and in my family to have a baby, it'd been so long since anyone had had a new baby that it was like, "Oh, this is just new motherhood." Like, it's just like she's not sleeping and
Yeah.
she's trying to figure it out, and so she's really worn out, and so I think it was more chalking it up to being like depression never was spoken out loud, like anxiety never spoken out loud, and so for me, I took it as a failure when they started and they weren't speaking in diagnostic terms, but when they were talking about care and treatment, and when I went for the first time, it was just for a support group. Paige from the Motherhood Center ran a new mom group, and I saw it through the Upper East Side Moms Facebook group, and someone was like, "Oh, like, new moms looking to connect," and I was like, "Oh, that's
Yeah.
me," like, it didn't register to me, and I remember a mom in that group saying, um, "Yeah, I've been a couple times now, and I've been to some other ones, and I like this because people talk about real things. It's not about, like, she didn't say putting on a show, but it wasn't about, like, the aesthetic of motherhood, it was, like, real mom talk," and I was like, "Oh, yeah, okay, like, I want real mom talk," not knowing what that meant,
Yeah.
or if it like they were saying the things in my head out loud. Um, but I remember when, because I went to that new group, and then after one of them, Paige said to me, she's like, we have more services. We offer individual therapy if you want to come in and talk with one of our therapists, like very, very gently. I think she could see that I was deer in the headlights.
Yeah.
Um, and so I did. And that's when they did the full assessment. Excuse me. And my doctor, between the new mom support group and going for the assessment, I had my 6-week postpartum visit and I got the perfect score on the Edinburgh scale. And she looked at me and she was like, "You said you're okay. Are you okay?" And this is the end of my appointment. Like the paper had been sitting on the counter the whole time. And I presented very well. Like, I was doing my makeup, I was putting clothes on, I was getting dressed because it was the perfectionism in me, like, I'm not gonna let anyone like, I have a baby, but, like, that's not an excuse to wear sweatpants, that's not an excuse to not look presentable, like, I have to gather myself. So, I presented very well, and, like, I was getting the baby dressed, and we were going to the appointment. But I was holding it together so tightly. I was in the, like, I can't let them see me sweat, like, this is not an acceptable way to be a mom, this is not an acceptable way to exist, like, so many people want what I have, which is a healthy baby, and, like, I can't let on to anything. Anyway, so
Yeah.
she looked at the thing and was like, "This is concerning. I'm writing you a prescription for Zoloft." She asked about if I had support, and I said, "I mean, I do, like my husband, but he works." And my mom had just left. She was in New York for a month and had to go back to work. And she
Yeah.
was like, "Well, I would fly home and go stay with your mom for the rest of your maternity leave
Wow.
and find a therapist." And I was like, "What are you talking about? What is" she never said the words postpartum depression.
Mm.
She never like gave me she just said like she said this is an antidepressant Zoloft. But I was like, it wasn't clicking to me. And then when I went in for my evaluation, it ended up being like a day or 2 later at the Motherhood Center. I said like, "Oh, my doctor gave me this prescription and this and there," and they talked me through it. And I was like, "I didn't pick up the prescription. I never picked up that prescription." And they were like, "Well, we really want to talk with you about what your needs are." And I'm like, "Well, I also have a lot of plans. I'm going to Florida. I'm going to St. Louis. I'm going to Las Vegas for a bachelorette party. I'm still on maternity leave. Like, I am entering my like freedom phase. Like, I'm like, motherhood is not slowing me down. This baby
Yeah.
is coming with me. And so, like, you can give me a plan, but you need to like work into the plan that I'm piecing out of here with this baby and everything's gonna be just fine." And, like, I can still remember them being like, well, we'd like for you to put an appointment on for when you get back. Maybe we can just touch base when you're returning. Because they like recommended me to go to the PHP program right then and there.
Yeah.
And I was like, no. And I remember they walked me out with a pamphlet with their card with their phone number written on it. Like, how they kind of like give you articles so you can like hold on to things. Being like, yeah, okay, like I don't need all of this. I'm not that bad. Like, I'm not like, this is just like, it's not that bad because I wasn't saying how bad it was and I was trying to like pretend. But it also really like wasn't registering to me like how serious things had accumulated.
Yeah.
Um Anyway, I got back and came back on that appointment sobbing after the trip, and they're like, "You need to start tomorrow." And it was like I was having very intrusive thoughts, and I was trying
Mm.
to I said, like, I'm looking to escape. I can't do this anymore," and was, saying the things that get you, um, more serious need for treatment,
Yeah.
and that's how we met.
That is how we met, and I'm sorry you went through that, and it's sad that, like, as I listen to you talk about it, I put myself back there and I'm, like, jealous that I wasn't where you were, like, I can't even imagine getting dressed, taking a shower, like, doing my hair or makeup, and, like, the fact that you were even able to do that, like, that blows my mind. I can't even, like, go back there and imagine that.
I think in one sense, it was protective, and in another sense, it was completely destructive because it goes to, like, how tightly I was holding on to the perfectionism. I mean, like, by the time I was, like, 3 or 4 days into the PHP program, I wasn't doing that anymore. The scaffolds fell very, very quickly
Yeah.
because they had to, but for me, the perfectionism was, you have to show up, you have to put yourself together, this is the only way to be a good mom. Like, it was a to-do list, and if I
Yeah.
didn't do that, it somehow meant I wasn't caring for the baby. Like, it was, and I was clinging so hard to, while also struggling immensely. Like, there were days when, like, I had nothing on, like, no appointments, no anything, and I would just sleep in bed all day. The baby was just sleeping there, and, like, he'd be in his snoo, and I'd get him out and feed him, and then I'd put him back, and I'd be right in bed, and I wouldn't take my pajamas off, but, like, if I had to be seen, I, like, had to put on the armor. Um, but I remember being like, similar to how you were saying, like, you had, like, judgy feelings towards that mom, your coworker. I remember I walked in for that one-on-one evaluation appointment after coming back, and it was, like, messy bun, a complete mess, just, like, tears flowing down my face, like, so overwhelmed, and they're like, "We're gonna get you help." And then as soon as I signed up, like, they were like, "Come back the next day," and then a lot happened that day when they said I need to come back the following day and push the day.
Yeah.
Um, and I was like, "Okay, like, one more day." But I came like, knowing that I was getting help, like, I went right back. Like, I remember, like, I was wearing jeans and, like, a nice sweater and, like, did my makeup and hair, and I remember walking in the first day. I mean, we could talk about like, it was a really, really intense day to start.
Yeah.
Um, and I was so overwhelmed by everything that I was hearing that I was like, I think I changed my mind. I think I'm actually better now.
Mm.
I don't actually belong here. Like, I'm not that bad. Like, I remember because, like, I guess we could just talk about, so there was a mom in the group who lost her battle with depression. Um, and that the day that I was supposed to start in the program. And so they called me that morning and said, "Hey, just give us a little more time. We have to figure out some paperwork. Let's start tomorrow instead." And so my first day, I don't know if you guys had session that day or not, but like, I remember my first day is the doors were closed, and there was another woman when I got there being like, "Oh, they have a morning meeting. This doesn't usually happen. Like, it's probably just running over."
Yeah.
But not, I didn't know that was atypical. Like, I was just like, the doors are closed until it's 9:30 on the dot, and they're gonna come out and open them. And, like, people were, like, gathering. all of us were showing up with our babies, and I was, like, looking around like, "Am I here to make friends?" Like, "Hi, I'm Claire," like, trying to be, like, normal and, like, again, having no idea the gravity of things that were going on, and also not even able to say out loud, "I have postpartum depression." I was like, "I'm here because I don't know how to be a mom, like, I'm just trying to figure it out," and, like, it was very I was not I was there, but I was not, kind of.
Oh, yeah. Real
Yeah,
feeling.
yeah. It was a lot.
It was a lot. That's a very real feeling of being there and not being there. And also, I just think that a theme that keeps coming up is just like the way that things look on the outside, versus what's happening on the inside. And you don't know what battle someone is going through. Best armor, aside, you just can't tell. And that was a really hard day. It was also the day that I decided that I wasn't going to lose because I had, for the first time in my life, had really strong feelings about suicide. Um, I really thought I was just it had to be it. It was just too much pain. Um, and I did consider walking in traffic the week before, and then having lost my friend, that wasn't an option anymore. So it's interesting, the way that things work out and what it's gonna take to kinda change. That was a tipping point for me that, I had to make it. And I'm glad that you were there. I think part of that particular program is that people were in different phases of healing because you got to look back and forward. And
Mhm,
and that's something that was really unique, I think, about this therapy. I had expected it to be very girl interrupted, and I didn't like the idea of like being in group. That just sounded way too intense. But hearing different days, people say, I'm feeling better today was huge. And also hearing someone say, I'm not okay. But if you are feeling better that day, being able to say to that person, but you will,
mhm.
because I'm okay today. I think there was something really unique about that. And like, you came in kind of at the beginning of your journey, and I'm pretty sure I was at the point where I was starting to turn the corner
Mhm.
to be a little bit better. And then we were able to connect and take care of each other in the different phases that we were in.
I feel like we've talked about this before, but I feel like I remember when I was going in initially for the new mom group and my initial evaluation, I remember you and Dave coming in and it must have been like the morning your therapist said, like, "Tomorrow morning, you have to go be seen," and being, like, sort of, like, in passing in the hallway and, like, elevator bank with each other, because then I remember it was, like, 2.5, 3 weeks later when I started, and you were there, and it felt like kind of like a big sister relationship a little bit of, like, looking to you, of you'd already been there and felt like you knew the flow, you knew how the group operated. Like you just said, like you could look forward and backwards, and you were getting closer to the exit, whereas I was like just beginning. And so I don't know how long you were there in total. I ended up being there for 5 weeks, and I think we overlapped for maybe like half of like the first half of it for me. But I remember and it's like a decision, it's a mutual decision to be discharged. I remember when they told me like some people are here for 2 weeks and some people are longer, and like everybody anchors on oh, I'm going to be in and out in 2 weeks. I'm going to be the
Yep,
person who just needs a little bit of care.
that's right.
And I was like, "I actually only have 2 weeks because my maternity leave ends and I have to go back to work." And
Yep,
over my dead fucking body am I telling work any of this happened. This is a
yep,
blip on the radar. I'm gonna go sit in the chair, go to group therapy, get my help, and get the fuck out.
right.
And no one's gonna know. This is our little secret. No
Yeah.
one is ever gonna see my face again. No one is ever gonna hear about my name. Like, this isn't real. This is just a blip, and we're gonna
Mhm.
solve it in 2 weeks, and I'm gonna show up to work on Monday, October 4th, and everything's gonna be fine. That's not what happened. I had to call my boss and explain, and who was the most supportive, could not have been more supportive,
Yeah.
like if I
You're
had
lucky.
tried, and he was like, "Take all the time you need, you don't need to explain anything to me, get the help, come back when you're ready and healthy."
Amazing.
Um, so ended up being there for 5 weeks, but I remember like, 'cause you talked about in group, like, deciding to be like, "I think, a couple more days, I think I'm ready, I think I'm gonna start." This is like you did, like, the half day, and feeling really nervous because by that point women had already left and new women were coming in. So it was this like constantly changing
Yes.
group, and your role in the group changes, which is also why I think the therapy is so effective. But I remember I'm such a rule follower, and like maybe this is like the type A in me being like, Jamie's probably like me and was like, this is a blip on the radar and she's going to go on. And like, this is like our badge of honor secrecy. We're not like whatever. And I'm never going to see this woman again. And here I am feeling so connected. And like, I remember it was in the nursery. You approached me and you were like, "Hey, so I feel like we've really connected. Do you want to exchange numbers?" And the relief I
Oh,
felt of like, she wants my number. Like I felt like I was being asked out on a date. I was like, fuck yeah, let's go.
that was
Then
easy.
I also remember being like, are they going to find out? Are we allowed to do this?
Yeah.
Which is like, there's no rules. Like we're consenting adults here.
Yeah.
So like, thanks for asking for my number.
God, of course. I would ask for it again. Um, yeah, and Claire and I joke because I say that you're my most expensive friend because great treatment costs money. So it was an investment that I made in my friendship with Claire, my most valuable friend.
And we will be recouping that ROI for the rest of our lives.
Wherever. Yeah.
Forever,
Interest.
forever. We had a rough start together, and we've been through so much the last almost 8 years. What does motherhood look and feel like for you now? I know our daughters are born a month apart right after the pandemic, so we both have 4.5, approaching 5-year-old daughters as well. I lost my marbles and did it a third time, but how have things changed for you from early days of new motherhood almost 8 years ago to where you are now as a mom of 2?
Yeah. Oh, it's so different. And it's such a relief, which I think I should be proud to say from where I came from. When I had my daughter I'll say it's a totally different experience. It's a 50-50 shot. If you're going to have that, the experience of postpartum depression or anxiety or psychosis, again, chances go up if you had it the first time. But I'm fortunate enough to say that I did not experience it the second time. And it was beautiful. And I really enjoyed the experience after having my daughter. It made me feel sad and reflective for what I might have, missed out on with my son. But having been through that, you really appreciate, I think, everything a little bit more,
Totally.
especially because, like we said, there are some women that don't make it. So if we're gonna make it, it's good to appreciate what you have. My confidence in my role has grown. It's hard sometimes. It's hard a lot of the times because there's still no rubric and you still don't know if you're doing a good job or not. But you keep those kids alive and you bring them up in little wins. I think you are able to start to see success in mothering and moments with your children to know that they're thriving, and that gets you through, in addition to the types of friendships that you make, and they can come from all different places. But like, having met you, Claire, and we're able to connect and understand each other without saying much, that's a special kind of friendship, mom to mom friendship, someone who really understands what you're going through and can help balance you out. So I'm in a place now where I'm in love with my kids. The connection is fully there, even if it wasn't at the beginning. And I do look forward to all the moments that I get to have with them. And as they're getting older, it turns into a different kind of relationship, and the closeness that you feel with them changes, and they understand you, and you learn a lot about yourself because they're like little mirrors. So I've learned some things about myself from being with them, but I have a positive outlook on it now. And I did go through this horrific experience, but if I can help protect or save or comfort another woman going through this, that's my purpose now, and I'm good with that.
I think that's something that I've so appreciated about how I've seen you share your story and taking opportunities to advocate and to speak out and just about the various levels of systemic failure, but also intervention. Like in the
Yeah.
hospital, postpartum, watching you speak on a panel recently about your experience with motherhood and how that has helped shaped and transform you as a career woman, but also in how you intervene with the other moms in your life. It's really giving back and it's just helpful. Like I just don't have, I think, enough of that connection. And I think especially when you're in it as a new mom, you can feel like you're the only one in it.
Yeah.
And I also think it's really hard sometimes as we get not well, we do get older, but as we get into being never, as we get to having older children could can be easy to forget how hard the new days are. I think for you and I, because the experience we went through, I will never be able to forget that. But I think still being able to show up and have empathy and provide perspective for moms who are going through it for the first time is so important. Like just because we're out of it, the conversation doesn't end. It's not going away. Like, and I also think it kind of shows up not in a depressive way, at least not for me. Like, we're still new moms to 8-year-olds. Like,
Yes.
this like sinks on me all the time because having three now of three different ages, I think like I have so much confidence with the baby because it's my third time doing it. Whereas something with RJ, like when it comes up, it's the first time I've ever had to deal with that, even though I've been dealing with mothering and motherhood things for 8 years almost. It's my first time having a kid who has, conflicts with friends or at school or activities or like fighting with sibling, all these things that we have to figure out as like true parenting versus like keeping the baby alive that we're still challenged with. And so I just feel like there's something so special about having these relationships. And I have like you to thank for like sticking with me all these years as just someone who we can always just pick up the phone and pick up exactly where we left off. Like moms need that.
They do. And I always will. Of
So thank you.
course. Thank you.
Thank you so much for sharing what you've been through today. I know the further we get out of it, sometimes it's hard to talk about, and there are emotions that get dug up from the past. All of the episodes this month are dedicated to Maternal Mental Health Awareness Month. There are going to be resources in the show notes for anyone who is struggling or knows someone who's struggling. But Jamie, I so appreciate you sharing your stories so bravely and openly. And I'm so, so grateful for your fight and for your friendship.
Thank you. Me too. Thank you so much for having me on.
You're always welcome back. We'll make it more fun next time. Because some people should know that outside of having moms that experience postpartum depression, we have a lot of fun together.
Yeah. More fun, maybe.
Maybe. Okay. I love you.
Love you.
I hope you enjoyed this episode of The Catch Up with Claire. If you did, I would so appreciate if you subscribe, follow, rate, and comment wherever you're listening from. Share it with someone else you think might enjoy listening. This is how I can continue to have these conversations and bring these conversations to you. Until next time, be kind, be brave, and be safe out there.